Like today we can discuss some of the GT questions, okay? Nearly 50 questions. We can go with a slow and steady manner, right? First, see here a 12-year-old daughter. She is coming to OPD. She already has periods, okay? But there is no evidence of any puberty. So, knowing the usual first sign of onset of puberty, you should ask the mother which of the following questions. So, the first sign of puberty, main things whether axillary or pubic hair or breast, but we should ask breast, okay? Has your daughter started to develop breast? Next, like in advanced stage of liver disease, there is a growth of small bacteria in the intestine. So why this intestinal bacteria growth and cirrhosis are related? Why? Mainly in advanced liver cirrhosis, this bacterial growth is occurring because of it is linked to bacterial translocation and PBP. Okay, so these changes or promoting factors are Paneth cell deficiencies in defenses. Paneth cell defenses, there are deficiency and intestinal motility is reduced and pancreatic biliary secretions are reduced, and also portal hypertensive enteropathy. So 4 factors. There's reduced intestinal motility and decreased pancreatic secretions, portal hypertensive enteropathy, and Paneth cell defenses or deficiency. Okay, they are giving right one of the right renal cyst. What will be your advice? For cyst, no treatment is required, right? This is called Bosniak grade 1 cyst. Oh my goodness. Okay. Here they are giving an X-ray. That X-ray is showing a crescent sign. They also mentioned there is an X-ray of old TB patient. History of old TB present with cough and hemoptysis. The chest X-ray is given. They are asking what is true. Okay, H, which is a crescent sign, is a cavity lesion surrounded by crescent of air seen in aspergilloma or fungal ball is called an air crescent sign. A cavity which is surrounded by air. The position of fungal ball changes the change in patient's position, body position. When seen in CT, it is called as monod sign. On a CT image, air crescent sign is specifically reserved for an angioinvasive aspergillosis and not in CT image. If it is present, means it is reserved for an angioinvasive aspergillosis and not for aspergilloma. So here they are given occurs when intrapulmonary lesion communicates extrapulmonary space. Wrong. Size reduces with inspiration. due to negative pressure. Size reduces with the inspiration due to negative pressure. Wrong. Most common presentation of a solid material mass. Wrong. Moves with changes body position. Correct. Functions of thyroid cells: collect and transport iodine. Okay. Synthesis thyroglobulin. Okay. Secrete thyroid hormones. Okay. Synthesis thyroid hormones. Why is not right? Like they secrete the thyroid hormones but not synthesizing it. Okay. Gene which share the same locus of 11p13 as that of WT1. WT1. Have you seen this gene? It's a Wilms tumor associated gene. It is an autosomal dominant gene for aniridia. PAX6 both located on the chromosome 11p13. Actually, WT1 and PAX6 are both are located in 11p13. If any patients with deletions restricted to PAX6 with a normal WT1 function develops a sporadic aniridia and iridia, but they are not at increased risk of Wilms tumor. After fracture of pelvis, a female is unable to conceive. This is called sterility. If inability of the male to get children or in a female to conceive children is called sterility. Frigidity is inability to initiate or maintain sexual arousal pattern in the female. Frigidity, initiate that feeling. Sexual dysfunction is an impairment either in the desire or gratification to achieve it. See, a 27-year-old, a Nalli Gravida, she has underwent a laparoscopic left salpingo oophorectomy for persistent 7 cm cyst. Okay, salpingo-oophorectomy. That was causing pressure and pain. The cyst was removed intact and peritoneal washings were negative for cancer. The final pathology report revealed a serous, low malignant potential tumor. What is the most appropriate management? Like we should close observe the patients. Why? Only close observation is sufficient because the capsule is intact. Negative peritoneal washing and final histopathology is suggestive of low serous malignant tumor for which no chemotherapy is required. Only close observation is sufficient. If LMP is diagnosed intraoperatively, premenopausal women who have not completed the childbearing may undergo fertility sparing surgery with preservation of the uterus and contralateral ovary. Removal of contralateral ovary, omentectomy, multiple peritoneal biopsies, bilateral pelvic and palatal lymph node dissection is not required. Hysterectomy with the removal of contralateral ovary can be done if female is postmenopausal, but in premenopausal women, fertility sparing surgery can be sufficient. Next question. Each of several urine analysis, a 24-year-old woman with endometriosis diagnosed laparoscopically during late adolescence complaints of worsening dysmenorrhea, dyspareunia, dysuria, urinary urgency. Each of several urine like endometriosis. Okay, each of several urine analysis and urine cultures has been negative for infection. The following would be least suitable to further evaluate this patient. CT. Answer is CT. Cystoscopy can be done. Transvaginal sonography can be done. MRI also can be done, but CT is not a CT scanning plays a limited role in evaluation of endometriosis. It is because TVS images of endometrious wall and CT has poor sensitivity for small implants and plaques. Just CT is preferred for thoracic endometriosis.